Turn back now to the coronavirus. It is Thursday, our day to bring in doctors to answer questions about COVID-19. And today, Channel 3's Kara Sunland spoke with an infectious disease specialist from Hartford Hospital.
We're back with Dr. Faiqa Cheema, an infectious disease specialist at Hartford Hospital, and she's been answering our COVID questions. We want to start by talking about the impact of the virus on those who are under the age of 60. Thank you, doctor, for being here again. What do we know about COVID recovery for people younger than 60 years old?
That's a great question. At the initial onset of the outbreak around early March, we saw that a lot of the people who were impacted by the virus were people who were 60 and above and had underlying medical conditions. As summer has hit, we're seeing that the virus is impacting a lot younger population, age groups in the 30s and 40s. Even if these individuals were to get infected with the virus, we're learning that the recovery time for these patients is much longer. Unlike the flu, if you were to get flu, you recover in about 7 to 10 days. We're seeing that individuals who are in this age group between 30, 40, or early 50s, their recovery from COVID-19 can take up to 4 to 6 weeks and even longer, up to 3 months. You will have good days, but there will be many days that you will be short of breath. You may have the symptoms of COVID come back, what we call relapse symptoms.
Okay.
So, there's not a lot of education on this, and I just want to spend some time disseminating and talking about this a little bit more, that your recovery from COVID-19 may not just be a one-week thing. It may take time, so just be patient, but you will get better.
And lastly, what's the one thing you've learned about how to treat COVID patients that's most significant to patients having good outcomes?
That's a great question. Even though the virus has been around for about 6 months, so far, I think to our success in science, we've learned that based on placebo randomized controlled trials, which is the best way to learn any information in science, is that two agents, if used appropriately and early on in COVID-19 patients who are admitted to the hospital or are on a ventilator or have low oxygen levels, using steroids and using antiviral agents such as remdesivir early on has been shown to be of great benefit in this group.
Good to know the doctors are figuring out a few more things as we go along. Thank you so much for answering our questions and for being here with us.
Thank you for having me.